Hey guys, it's Dr. Courtney here. I had a few non-surgical rhinoplasties today. This is where you inject filler around the nose. A few of the questions is where do you inject and why? So I wanted to show on my face where the arteries are that give supply to your nose. So you have this facial artery that kind of comes up through this direction, this way. It turns into the superior labial artery here. This gives blood supply to your lip. Then you have a columellar artery that it connects to the superior labial artery. This turns into what you call your angular artery here. The angular artery gives off a lateral nasal artery here. And then the most important one when you're injecting the nose is a dorsal nasal artery that comes in somewhere around here. So there's a lot of collateral flow to your nose. You also have a supratrochlear and supraorbital artery here. So when you inject on the nose, you want to stay medial. So you can inject here in the tip. You can get a super tip break, which is very desirable in females. You can inject here along the dorsum. So if you have a dorsal hump, then it can correct that hump. But more importantly is knowing where these different arteries are so that when you do inject, you're not inside the artery. And why is that important? Well, if you get inside this particular artery, the dorsal nasal artery, it actually connects to the artery that supplies your eye, and more importantly, your retina. So that's why it's important to know your anatomy, because this is a very bad complication if you get it. So this is the reason why we go to medical school and all this training is to learn where all these facial arteries and nerves are, and the success of surgery is reliant on this anatomy. So knowing how to do a rhinoplasty or a facelift, or even to do blepharoplasty where you rejuvenate the eyes, all these things come into play so that you have a great outcome and you don't compromise your vascularity to get a poor outcome. So that's why it's important to understand the anatomy, and it also comes in handy when doing injections.